Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your host, Gary Dodge.
And Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people that we request that you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Thanks, guys.
Happy Friday.
Happy Friday.
What are the next steps for the tribe as COVID cases continue to increase?
So since COVID cases have been increasing, the tribe has issued an extension of its latest orders. That means everyone is going to remain on remote work until October 23rd, if possible. We're going to have some of the, vital personnel on staff, our physicians, individuals in transit, people that have to be there housekeeping. But right now, the incident command team is working both with the legislature and tribal admin, and we're discussing ways to find, how we can keep our local economy going, but keep our individuals safe. So we might be coming up with some new hybridized methods in the next few weeks. But right now, remote work is the thing we're going to do.
So this week, the chairperson sent out a video message to the community, and in that video, she mentioned a possible shelter-in-place order if things do not improve. What would that all entail, or what would that look like?
So a shelter-in-place, it's kind of like what was issued earlier in the year, and it's basically a lockdown or where we try to minimize the amount of movement that occurs on the reservation. It'd basically be shelter in place at home, telework, leave only for issues like medical attention, purchasing food if you need it, or, if there's a public safety issue, fire or police, things like that. It also include, shutdown of things like, the public parks and spaces, so people wouldn't congregate as much, in the attempt to decrease the amount of viral spread. So it'd be kind of like that.
So what are the main types of interactions that are causing the spread that we see right now in the community?
So right now we've been seeing community spread, which means there's really no large scale single event that we can point to it as a cause. No, game day where everyone meets together in, the stadium, or, no powwows or anything like that. It's been small actions like people sharing rides in cars and not using masks, or people visiting other people's houses, or there've been instances where people have ignored quarantine and have, gone out into the public to do whatever they felt like at the time. So a lot of it's, not wearing masks. Some people have visited the elderly, and they've done it asymptomatically. It's not like they've done it maliciously. You can, spread COVID before symptoms arise. And so that's where a lot of the spread has actually been. People that have been like, oh, I didn't know I was sick. And so there's kind of a discussion of, the question between causation and correlation. There are a lot of these small events. We can't point to any of them as a specific cause, but when we see a lot of, ride sharing or movement or visiting of friends and family, we can say that there is a higher likelihood of COVID spread. Not saying that is what's causing it, but we do see an increased number of cases with that. So it's just hard to pin down right now.
I know we've asked this question before, I think, but is it possible for someone to become reinfected with COVID?
So there are multiple strains of the COVID virus out there right now. I think the last count says there's something around 30 different types of mutations. So yes, it is possible. And we don't know if you are infected with one strain, whether that gives you protection against all of them or whether, it's like a cold and you can pick up another one. So that's something that, a lot of the experts are still trying to pin down, is like, how does this happen? Or if it's the same virus that just comes back. I mean, you can have a reoccurrence of symptoms if people, aren't taking care of themselves health-wise. You can start to feel better. You can strain your immune system and through physical activity, and then you can have a resurgence of symptoms. So they're not sure if it's a brand new reinfection or if it's just recurrence of the same case. So we're not sure. Sorry.
Now that we are having a higher number of people becoming infected on the reservation, can you just go over what kind of the recommended treatments are for people that are experiencing COVID right now?
Yeah, so some of the CDC guidelines, and speaking with some, emergency room physicians and doctors that we know, there are some things that we recommend if you do have a COVID case. One of those would be taking about 500 milligrams of vitamin C twice a day. Helps boost the immune system. They've found anecdotally that vitamin D and zinc are also good supplements to take. And for older patients, they've also recommended a baby aspirin if they're not taking those. That's to help with essentially thinning the blood to prevent any sort of complications that might arise, because COVID kind of works unpredictably with the immune system and can cause inflammation and clotting in strange, in somewhat unpredictable ways. And so they recommend a baby aspirin to prevent or lower the likelihood of something like that happening. Another thing one of the doctors recommended was, if you can afford it, grab what's called a pulse oximeter. It's the little thing they stick on your finger when you go to the hospital. What it does is it measures the oxygen level in your blood system. Usually you'll have, between 99% to about 96, 97% saturation of oxygen in your blood. If it drops down to like 94% though, they recommend you going to the hospital. Call first, let them know that you have COVID, that you're experiencing symptoms, and that your oxygen level has been decreased. If you want to get one, they're all over the place on Amazon. They're not too expensive. They're, between, $15 and more, depending on how fancy of one you want. But that's some of the recommendations they have right now. Of course, wash your hands for 20 seconds or more, soap and water. Do it like you're obsessive compulsive. If you have any questions if you should be washing your hands, it means you should be washing your hands. And then, maintain physical distance from people, things like that.
Will there be another mass testing event on the reservation?
Yes, there are. IC is actually in contact with the National Guard right now. We're looking like we'll get two of them set up. One will be on the reservation. Another will probably be in Shawano. Those may be in the next 2 to 4 weeks, depending on the Guard's schedule and how quickly they can come back. And we'll have more details in the coming week about, when those will be and where they'll be held.
What are the top 3 things people can do to stop the spread of COVID in our community?
Oh, wash your hands with soap and water. Wash, wash, wash. Anytime you have questions, wash your hands. If you're going to eat, wash your hands. If you've come in from outside, wash your hands. If you use the restroom, wash it. He's in a public restroom. Man just walked in and walked out without washing his hands. Gave me the willies. Please wash your hands. Just saying. Yeah. Some people, they like to turn it into a game and tally how many times they've washed their hands in a day. They compare with their family. It's kind of a weird thing, but it could be fun. Wash your hands. The second thing is avoid crowds. Physical distance is key to, preventing contraction of the virus. Don't spend time with groups outside of your immediate family as much as you can, especially since there's community spread, and most of the time people contract the virus or spread the virus when they're not symptomatic. So if you can avoid crowds and people outside of your immediate family and household, that'd be best. Also, if you're going outside, wear your masks. That's number 3. Bonus, if you want, get as much sleep as you can. The more rest you have, the more effective your immune system it is. So if you are taking care of yourself physically and you're well rested, you'll definitely be able to fight off any sort of infection, COVID or otherwise, better than you would if you were fatigued.
Thank you, Vaughn.
Yeah, you bet. Thanks for having me back.
Waiwanan for listening to the Nominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast at menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn. We welcome any community questions that you have regarding COVID-19, so please send those in to us via email at podcast@mitw.org.